small intestine and a part of large intestine, and finally there, with the help of bacterial enzymes present over there, it will get converted either into stercobilinogen or urobilinogen, and 20% of this is getting recirculated. This is the normal mechanism. ये तो हम क्या पढ़ रहे हैं अभी? Normal mechanism. If there is any problem in this particular flow chart, okay, definitely there will be increase in the serum bilirubin level. Okay, the first thing is erythrocytes. Okay, normally their lifespan is 120 days, but in some pathological condition, either due to the deformities in the RBCs, okay, or either in the problem in the hemoglobin chain, either may be the case the RBC may not have the normal lifespan, so there will be excess of destruction of RBC. तो फर्स्ट स्टेप अपनी जॉन्डिस के लिए क्या हो गई? हीमोलिटिक जॉन्डिस, है ना? हीमो ब्लड, आरबीसी वी आर टॉकिंग ऑफ, लाइटिक ब्रेकडाउन, हीमोलिटिक जॉन्डिस. नॉर्मल अगर मैकेनिज्म चल रहा है तो वो उसको कंपनसेट कर रहा है, पूरा मैकेनिज्म अपना नॉर्मल चल रहा है. बट फर्स्ट टाइप ऑफ जॉन्डिस जिसको अपन देखते हैं वो होता है हीमोलिटिक जॉन्डिस. वो जॉन्डिस किस वजह से होता है? Excess of breakdown of RBC. Now, excess of breakdown of RBC may be due to what? Maybe there is problem in the structure, shape, size of RBC. Maybe anisocytosis, maybe poikilocytosis. Okay, so that means one of the reason for the lysis of the RBC. Another cause may be there may be problem in the hemoglobin change, thalassemia. Okay, that is also one of the reason for hemolysis. So when there is this type of breakdown of RBC, that will automatically result into the increase in the bilirubin level. But which type of bilirubin level? Unconjugated. Conjugated until unless it will come into the liver, because liver, the hepatocytes, they are functioning normally. The functional mechanism getting disturbed is at the primary site. Okay, it is not reaching, because whatever the amount that is coming to this will get conjugated easily, because there is no malformation and malfunctioning of the liver. It is the problem of the excess destruction of RBCs which will result into which type of anemia? Hemolytic. Hemolytic jaundice. Okay. Another problem may come into the liver. So which type of jaundice? Hemolytic jaundice, hepatic. You know, that may be due to the infection taking place in the liver. Okay. Inflammation taking place in the liver. Whatever be the cause, the normal functioning of the macrophage or the hepatocyte does not take place. So there will be increase in the conjugated as well as unconjugated bilirubin level. Okay. Clinically, when we are saying that it is jaundice, when the concentration of serum bilirubin level reaches more than 2 milligram percentage. So this 2 milligram percent is combination of conjugated as well as unconjugated. Okay, sum up of both the type of bilirubin, conjugated and unconjugated. Okay. Then if the problem comes post-hepatic, okay, from the liver, this complex, that is bilirubin UDP complex, it is coming into the biliary secretion. Okay, so if there is any sort of obstruction which is restricting the flow from the hepatocyte or the liver into the intestine, there is obstruction, the flow is not coming, then it results into post-hepatic jaundice. Okay, cholestatic jaundice, because it is obstructing the flow of biliary secretion. So 3 type of jaundice: hemolytic, hepatic, post-hepatic or cholestatic jaundice. Okay, and what is jaundice or icterus? It is increase in the serum bilirubin level above 2 milligram per cent. For that to understand, we need to have the idea of the basic breakdown of hemoglobin. ठीक है, आरबीसी का ब्रेकडाउन क्या होता है, जैसे इसके अंदर एंजाइम्स है ना, कैटलेज, रिडक्टेज, ग्लूटाथायोन, ये जो है ना, इनकी कंसंट्रेशन स्लोली डिक्रीज हो जाती है, एनएडीपी एक्टिविटी स्लो हो जाती है. जो प्रोटीन अपन स्पेक्ट्रिन पढ़ रहे हैं और एंकेरिन पढ़ रहे थे, एंकेरिन इज द प्रोटीन विच बाइंड्स एंड मेक अ मेम्ब्रेन ऑफ स्पेक्ट्रिन. So there is decrease in the contractile nature of this, which results into decrease in the deformability of the RBC. So that will be resulting into the easy rupturing of RBC when it is moving through the spleen because of the small diameter of the splenic capillary. And that's why spleen is known as the graveyard of. Okay. This is classification of jaundice. Jaundice, physiological and pathological. If it is pathological, it is prehepatic or hemolytic, taking place prior to liver. So another term is prehepatic or hemolytic jaundice. If it is hepatic, hepatocellular or hepatic jaundice. Post-hepatic or obstructive. Here it is the unconjugated bilirubin level. Hepatic is biphasic, both the type of bilirubin, and post-hepatic it is the conjugated type of. Physiological jaundice, you get a separate question on this, okay? Especially it has a unconjugated. Chale, next slide. Okay. Sorry. These are the features you have to write down. Okay. Hemolytic jaundice, obstructive jaundice, and hepatocellular jaundice. It is not only the classification, okay, the question will come, classify jaundice, okay, and differentiate the different types of jaundice. You cannot write this question elaborately in subjective manner, you have to write it in a tabulate manner, okay. Plasma bilirubin level in case of it is unconjugated and increase, but here it is conjugated, and in hepatocellular it is biphasic. क्या दिक्कत है लास्ट में? अभी 1 महीने बाद 2 महीने बाद जब एग्जाम होंगे ना, you'll come blank. Okay, and you'll not be able to answer these small things. अभी अपने को लगता है कि शायद हम 10th और 12th तक पढ़ के आए हैं. क्या हुआ मोबाइल पे? खड़े हो? हाँ, खड़े हो जाओ. Urine bilirubin level absent, okay, increase and often absent. Urine bilinogen increase, so these are the stercobilin and color of the feces. Increase, dark, decrease, pale, decreased or normal. Okay, this table you will be getting in biochemistry section as well. Okay, that is. So you have to have this table in physiology also, in biochemistry also. You might get question on this. अगर ये क्वेश्चन नहीं भी आता है तो ये वाइवा के क्वेश्चन हो जाते हैं. टाइप ऑफ जॉन्डिस और फेट ऑफ हीमोग्लोबिन और फेट ऑफ आरबीसी, बिकॉज हेमेटोलॉजी इज अ टोटल different lab in which we'll be asking related to blood only. Okay, ये मिल जाएगी बुक में, अपने को इतना नहीं है. These are the different tests you have to write down. Especially focus on this prothrombin time, the last section. Okay, when we'll talk of the clotting mechanism, liver is the main site where the different clotting factors are taking place or getting formed. Okay, so hemolytic jaundice, it is not concerned with the hepatocytes or the liver, so prothrombin time is normal. When we are talking of obstructive, it is prolonged. Here also it is prolonged and corrected by IV vitamin K. Okay, injection of vitamin K. Special focus on this, but these are the plasma aminotransferase substances. This is normal because this is pre-hepatic. These are all the features of liver function test, plasma alkaline phosphatase, stercobilin, color of urobilin. These are only taking place when the bilirubin reaches to the liver or the hepatocyte. So in case of pre-hepatic jaundice, the value of these factors or features will remain normal. It will get disturbed either in the hepatocellular jaundice or the obstructive jaundice. When we study for the semester exams or for the university exams, the syllabus is elaborated too much. Either you go for Guyton, GK Paul or any other book, okay, it is very much elaborated, so you have to make notes or go for flow charts, diagrams, okay, to give your knowledge, to show your concepts, how much your concepts are clear. Okay. Other characteristic features or the tests which are performed for detection of jaundice. Okay, detects the type of bilirubin present in the serum. It has direct and indirect tests. Okay. Blood examination, hemolytic picture in pre-hepatic jaundice. Hemolytic, it is the case prior to the liver, when it is reaching to the liver, so it is the hemolytic picture in pre-hepatic jaundice. Plasma albumin globulin levels, the ratio was 1.7:1. Okay, fecal fat estimation is done and the color of the fecal. These are the tests or the features which will go for treatment is. Okay. Now comes physiological jaundice, another important topic on which you get a short note. Physiological jaundice or another name is neonatal jaundice. Okay, physiological jaundice or the neonatal jaundice. Now what is the mechanism which will work for this is, at the time of birth the RBC count is more in case of newborn. Okay, but their liver or hepatocytes, they are not fully mature to take this much enormous destruction. Okay, so just after birth what happens is there is excess of breakdown of RBCs, but this excess of bilirubin is not being taken or taken by the hepatocytes or the liver. Okay, and so there will be increase in the serum bilirubin level, and this increase in the serum bilirubin level is known as physiological jaundice or neonatal jaundice. Generally this takes place after the birth of 2 to 3 days. Okay, correction of this, okay, is done with the help of phototherapy. Okay, with the help of therapy what happens is this bilirubin gets converted into a water soluble luminolubin. Okay, globulin की जगह क्या हो जाएगा, luminolubin. Okay, so this lumin means light. So with the help of photosensitivity, photoisomerization takes place. Okay, and this bilirubin gets converted into water soluble form. Clear? Okay, photosensitivity या phototherapy जो अपन दे रहे हैं उससे क्या हो रहा है, photoisomerization हो रहा है bilirubin का. Photoisomerization से क्या हो रहा है, this bilirubin getting converted into another compound. This compound is water soluble and that can be removed, and now the normal bilirubin level will take place and the correction is done with the help of phototherapy, and within a week this is corrected. But still, if there is excess of bilirubin level above 8, 9, okay, milligram percent in case of new, what happens is this bilirubin, okay, serum bilirubin reaches to the brain, because the newborn is not having a fully formed blood-brain barrier. Okay, because it is not having a developed blood-brain barrier, when this bilirubin reaches to the brain, okay, it results into permanent deafness. It results into permanent deafness. Okay, the condition is known as kernicterus. Icterus is jaundice, kernicterus is KER, that is the serum bilirubin level which has been raised beyond 9 mg% or 8 mg%. In case of newborn babies, where the physiological jaundice has to be corrected naturally with the help of phototherapy, but is not getting corrected with this phototherapy, this level has been raised, going to the brain, in the brain, because of the failure of the development of blood-brain barrier in the newborn case, okay, it results into permanent deafness, and the condition is known as kernicterus, and this is a permanent neurological damage takes place. Okay, so this physiological jaundice has not to be taken so simply. It has to be taken into great care, has to be corrected, okay, has to have a follow-up routine. Because in rural scenario, this is a common mistake taken by the parents, and that results into permanent damage of the child or the baby. Okay, this is a neurological deafness taking place. Okay, so एक physiological jaundice और neonatal jaundice से एक अलग ही अपना क्वेश्चन बनता है. एक तो हो गया jaundice, एक हो गया physiological jaundice. To be correct. ठीक है? Okay, also known as jaundice of newborn or neonatal jaundice. When it appears on the second or third day of life, causes hepatic immaturity. If bilirubin above 5 mg%, clinical jaundice appears. Clear? Okay. Another thing which we'll talk today about is anemia. कितना टाइम हो गया? 40 हो गया. एक पेज इधर सर्कुलेट कर दो विथ योर नेम, रोल नंबर एंड सिग्नेचर. एक पेज इधर सर्कुलेट कर दो और एक उधर. ठीक है? क्या हुआ? कोई मैसेज है इम्पोर्टेंट? नहीं ना? हाँ, जब मैं अपना मोबाइल छोड़ सकती हूँ ना, तो आप लोग भी छोड़ सकते हैं. 1 घंटे के लिए कुछ नहीं होता. Now state the definition of anemia. Okay, what are the different criteria of classification of anemia? Wintrob's and Whitley's classification. Write the etiological classification with 2 examples each. State the grading of anemia on the basis of hemoglobin percentage. Whatever are the objectives, these much are the questions which can be asked on this topic. जितने ऑब्जेक्टिव है उन सब ऑब्जेक्टिव के ऊपर अपने क्वेश्चंस बनते हैं और बन सकते हैं. Especially in your university or your semester exams, you get a case-based study related to anemia, which is most common. Okay, here we are dealing with the physiological aspect, okay, pathophysiology. Okay, but in your exam, you might get a question related as a case-based study, as a patient is coming to OPD, he's feeling lethargic, he's having tachycardia, palpitation, okay, cannot move, difficulty in walking. So these are the symptoms with which the patient may appear. So the problem-based study or the case-based study is this, in which a scenario will be given to you and you'll be able to diagnose and come to a conclusion with the help of the different symptoms, values, okay, and history. Okay, so you have to have a very much sharp observation कि उस क्वेश्चन में क्या क्या पॉइंट्स दे रखे हैं, उन पॉइंट्स को आपको पेन डाउन करके क्लियर डायग्नोसिस पे आना है कि अगर एनीमिया भी है तो किस टाइप का एनीमिया है, उसके अंदर किस टाइप के सेल्स होंगे और उसका करेक्शन क्या होगा. ठीक है, हर पॉइंट के 5 नंबर है. डायग्नोसिस 5 पॉइंट, क्लिनिकल सिम्टम्स 5 पॉइंट, लाइन ऑफ ट्रीटमेंट 5 पॉइंट, बट योर कॉन्सेप्ट इज बीन चेक्ड. Okay, you cannot argue that I have written anemia. Anemia is a broad thing. You have to be very much specific which type of anemia. है ना? केवल हम anemia नहीं लिख सकते कि 12th, the 10th, 11th की तरह, but we have to be very much specific what type of anemia is there. Okay, so state the definition of anemia, write their classification. The blue type is Winthrop's and Whitby's classification. Etiological classification with 2 examples with the grading of anemia on the basis of hemoglobin percentage. Analyze the common and specific blood pictures. Analyze the common and specific blood picture, clinical features of anemia, discuss the cause of morphological features of RBC depending on the cause of anemia, plan the line of investigation to detect the cause of anemia. If there is a case-based study, these things has to be keep in your mind. कि हम उसके लिए क्या इन्वेस्टिगेशन सजेस्ट करेंगे, क्या लाइन ऑफ एक्शन होगा, कैसे उसका प्रोग्नोसिस करेंगे, कैसे उसका डायग्नोसिस करेंगे. Yeah. So anemia. So before going for anemia, certain terms have to be clear with you in your mind. Okay. What do you mean by MCV? Is mean corpuscular volume. Here we are talking about RBC. अभी अपन केवल RBC की बात करें या एरिथ्रोसाइट की. So MCV is mean corpuscular volume. One term is mean corpuscular volume, means average volume of a single RBC. Mean corpuscular volume. Another term is mean corpuscular hemoglobin, MCH. MCH is mean corpuscular hemoglobin. Okay. Another important term is MCHC, mean corpuscular hemoglobin concentration. तीन टर्म्स क्या क्या हो गए? MCV, MCH, MCHC. The important is CI or color index. Okay, and all these 4 points, when taken together into consideration, okay, they are known as blood indices. Okay, when we'll do the different calculation of these formulas or these terminologies, okay, MCV, MCHC, MCH and color index, together they form a practical or a topic which is known as blood indices. So you get a separate problem-based question on these parameters. So this will take in your practical class. What are the formula, what is the normal value, okay, and how to calculate, and what is the scenario given to you for their calculation. Okay, here continuously you will get familiar with, again and again you will be encountering these terms. So I have made it clear. Mean corpuscular volume, that is the average volume of a single RBC. Mean corpuscular, average hemoglobin present in a single RBC. Mean corpuscular hemoglobin concentration when both MCV and MCH is taken into consideration. Okay, another is color index. Okay, anemia, it is defined as by reduction in the hemoglobin concentration or hematocrit concentration or the RBC count. When we talking of hematocrit, we were exclusively concerned with RBC because platelet and WBC they run in very less number. So when we take a sample of blood, add an anticoagulant and let it stand for an hour, the value which comes is of the hematocrit value. Hematocrit means the RBC. So the percentage of RBC, okay, that is the hematocrit. So when there is a decrease in the percentage of RBC, decrease in the RBC count or decrease in the hemoglobin concentration, either of the thing may take place. Both of these things can take place. Three all together can take place. So the combination can be either. But it is a condition that is known as anemia. Okay. So when there is anemia, what will happen is there will be decrease in the oxygen carrying capacity. Definitely, if there is decrease in the hemoglobin or decrease in the RBC count, or there is deformity in the shape or the size, definitely what will happen is the carrying capacity of RBC will decrease. So what will happen? Hypoxia. है ना, उसको कोरिलेट करोगे तो याद रखने में इजी हो जाएगा, ठीक है। और डिफाइंड एज 2 स्टैंडर्ड डेविएशन बिलो द मीन. Below the means when we are talking of count, it is 5.5 in case of males, 4.5 in case of females. So they have an average or a mean. Okay, so 2 values below the mean. Okay, now WHO criteria, what does it say? It says hemoglobin less than 13 in men and less than 12 in women is considered as anemia. But this is a WHO criteria. Okay, in case of developing countries, in case of developed countries, okay, underdeveloped countries, okay, this value is very less. In case of India, also in case of females especially, 12 is considered to be a good hemoglobin value. Okay, तो ये रीजन टू रीजन डिपेंड करता है कि किस टाइप ऑफ एनीमिया है, बट ये WHO स्टैंडर्ड के हिसाब से बात करेंगे. Then these are the criteria by which we can diagnose or say that the subject or the patient is having anemia. Okay, revised WHO criteria for patients with malignancy, then it is less than 14 in men, and for female it is less than 12. A clinical condition characterized by reduction in number of RBC less than 4 million or less than 12 gram% of hemoglobin. Okay, so anemia is a group of disorders. It is a group of disorders. Okay, the skin will become paler, the nails will become dry, the tongue will become atrophic. Okay, lips will become dry. Okay, the person will have lethargic, tiredness, weakness, anorexia. Okay, so these are the different symptoms. So it is a group of symptoms, clinical symptoms, which make it a single entity as anemia. Clear? The person looks at your skin and says, you are anemic. Your nails, your tongue. Okay, and अगर आप 4 step भी चढ़े and you get tired, normal walking is difficult. Okay, so these are the things which are seen. Anorexia. Okay, thought, slowing of your thought process. बहुत सारे इसके sign और symptoms हैं which is clinically making it an entity as anemia. Okay. Grading according to hemoglobin is mild, moderate and severe. How much time is left for today's class? सही बताओ. Okay, clinical manifestation, we'll do this much today, and in the next class we'll do the classification in detail, because that is a good topic and it is much of the marks coverage. बहुत अच्छा वेटेज है इसका. कह रही हूँ ना, कम से कम 15 मार्क्स कहीं नहीं गए इस एक अकेले टॉपिक पे. Okay, so it is the paleness of skin and mucous membrane, fatigue, weakness, dyspnea is difficulty in breathing, or palpitation and tachycardia. What do you mean by tachycardia? Increase heart rate. Why tachycardia will take place? Why tachycardia will take place in an anemic patient? Increase oxygen supply. तो वो क्या होगा फिर? Normal cardiac output is 5 liters, but there is increase in the requirement or demand, so that will give an extra load to the heart. So when there is extra load to the heart, the heart has to perform extra function, so it has to work more. So that is tachycardia, headache, dizziness, restlessness, okay, slowing of thought, nausea, constipation. Okay, this is the clinical manifestation of anemia. Okay, headache, general symptoms and signs: shortness of breath, particularly on exercise. Okay, palpitation, confusion and symptoms of cardiac failure in elderly. In case of elderly patient, weakness and lethargy. This is the dry nail. Clear? This is the condition of the nail. Tongue become atrophic. Okay, this is clear up. Getting pale, paleness. Okay, so clinical features of anemia. I think with the audiovisual section, at least you'll try to remember 3 or 4 clinical manifestation symptoms. Okay, इन symptoms के basis पे केस सिनेरियो आपको दिया जाएगा. तो ये symptoms अगर आपको रिकॉल रहेंगे तो you'll be able to diagnose it more specifically and properly. Classification of anemia, morphological and etiological classification. That will take in next class. Okay? Yes or no? Happy? Your attendance? क्या चीज? खड़े हो. साइलेंस. हाँ, क्या करें? भाई आपकी नॉर्मल ब्रीदिंग रेट चल रही है, नॉर्मल मैकेनिज्म चल रहा है, ऑक्सीजन रिक्वायरमेंट ज़्यादा हो गई, तो जो आपका ब्रेक होता है ना साइकिल, इंस्पिरेशन एक्सपिरेशन, वो शॉर्ट टर्म में जाएगा, इंक्रीज हो जाएगा, तो दैट्स एन रिजल्ट. तो जो ब्लड है ना वो सारे सिस्टम को इफेक्ट करेगा. अगर आपका इसका कॉन्सेप्ट और जनरल फिजियोलॉजी का कॉन्सेप्ट क्लियर हो गया ना तो आपके सारे सिस्टम क्लियर हो जाएंगे, क्योंकि ये सब जगह काम में आएगा, है ना. एक एक वर्ड जो अपन इसका देखते हैं ना कि आपका क्लिनिकल मैनिफेस्टेशन है, अब ये सिंपल है, पर जब आपके क्वेश्चन आएगा ना देन यू हैव टू कोरिलेट इट, टिल देन एट लीस्ट यू विल कवर 2-3 टॉपिक्स, सो इट विल बी मोर conceptual for you. Okay, where is the attendance sheet? This row. आपकी अटेंडेंस शीट इस रो की करो कंप्लीट फटाफट, अपना ही लिखना, ज्यादा टाइम मत लगाना. यहाँ की all those who have not done hemoglobin in your practical lab, silence. Okay, those who have not done hemoglobin estimation in laboratory, try to do it in this week. Whichever batch is coming, whichever day, Monday, Tuesday, Wednesday, Thursday, try to complete it, otherwise it will remain pending and pending. Okay, और पूरी क्लास की एक ही रीडिंग नहीं आनी चाहिए, सारे के सारे एनेमिक नहीं होंगे.